Hello, everybody. Welcome. I'm Jill Miranda, board member of OutCare Health. My pronouns are she, her, and I'm really excited to be here with all of you tonight. Thank you for joining us for OutCare's OutTalk series, a webinar series devoted to discussing diversity and intersectionality within LGBTQ communities. We have many people across the world tuning in today, and we want this to be a safe, welcoming space for everyone. So please feel comfortable asking any question today. Throw it in the chat if you feel so moved. All Out Talks are recorded and can be watched on our website, accessed after when the talk is done. I'm very excited for this particular series, Access to Care, Middle Eastern, North African, and Queer in America. Today, we'll hear from inspiring people doing amazing work across the country. I'm very thankful for a moderator today, John, and John, I'll let you take it away from here.
Thank you, Jillian. It's so nice to see you. Hope your day goes well. So I want to welcome you all to our most recent OutCare talk. It's an honor to be here today, and I'm very excited for this conversation. Just a few thoughts. Pride Month may be over, but support for LGBTQ communities is really important, especially to us here at OutCare Health. And we invite you to fight for the health, equity, and celebrate Pride 365 days a year by considering becoming a monthly donor. You can do that by visiting outcarehealth.org/donate to get it all started. And one of the programs that we have put together that's really amazing is we have regular ongoing monthly support groups. And if you are in need of support, we have some coming up, and we include our trans and gender diverse sessions, as well as Black LGBTQIA+ sessions. All outreach sessions, support groups are free and open to allies as well. And you can find information about that at outcarehealth.org/outreach. Those are my announcements for today. So once again, I'm very excited to have this conversation. And as we started out, I think it's very important for me to identify that I am not part of this community. And I want to make sure that we create space here for my voice to actually be marginalized and put in the background, and more of a guest here to learn and experience with all of you who are attending today. So with that said, I've asked each of our presenters to introduce themselves, tell a little bit about who they are and what they do in the world. And then they all get a surprise bonus question that they're going to hear right now for the first time. I want you to think back when you were childhood. What was a family comfort food that was just magical for you? Okay. So with that said, Sarah, if you're ready, why don't we start with you?
Yes. Hi, everyone, and thank you for having me. My name is Sarah Aboud. My pronouns are she, her. I'm an assistant professor at University of Illinois, Chicago, at the College of Nursing. So I'm a nurse by training. I was born and raised in Lebanon, where I studied nursing. I moved to the US to do my PhD, postdoc, and stayed. I've been in the US for almost 13 years now. My work specifically is related to exploring sexual and mental health. I look at that at the intersection of immigration, gender, and multiple identities within the Arab and Arab American community in the United States, and most specifically within the LGBTQ Arab community. So my work is very grounded in social justice and health equity frameworks. And in addition to the research that I do also a lot of advocacy work around the invisibility of the Arab or Middle East, North African identity, or the Swana identity as well, mostly to push for an inclusion of a separate racial ethnic identity within the US Census reporting system. So I'm excited to be here with you all. And some comfort food growing up. There was a lot. I mean, we like connect around food. Our family gatherings were always every Sundays around food. Something that I loved the most was mostly stuffed grape leaves are some of my favorite foods that I like. Yeah.
I love it. We're coming over to your house soon.
Yes, you're welcome.
Thank you. Hazim, why don't we have you step in now?
Of course. Hi, everyone. My name is Hazem Al-Anani. I'm he, him. Thank you so much, obviously, for having us today. I'm an international medical graduate born and raised in Syria. I have a master's degree in healthcare administration. I work with a national behavioral health organization called Rogers Behavioral Health based in Milwaukee, Wisconsin. They have a lot of outpatient clinics all over the country, 3 hospitals as well. I work with the medical staff office called, my title is practice liaison. I also representing tonight Tarab NYC, a social organization, a community-based organization for queer, Middle Eastern, North African people. We provide a lot of community support groups, similar to what you mentioned, John, earlier, free monthly support groups. We're looking to add another one as well. So twice monthly, we do a lot of social events, a lot of community gatherings, a lot of happy hours. We just wrapped up Pride. We did Brooklyn Pride, Queens Pride, and obviously Manhattan Pride was the biggest one. And it was a very valuable space for our community, given the recent events and what's going on in Gaza and Palestine. Comfort food, the Middle Eastern version of samosas. We call them sambusak. They're really good. And I'm having them tomorrow at my sister's place with stuffed grape leaves, Sarah. So you're welcome to join if you're in Tampa, Florida. But again, thank you so much for having us tonight.
Absolutely. And then finally,
I can go next. This is great. My mouth is just watering from the food, so I'm thinking about dinner now. Hi everyone, my name is Huriya Hussein. I go by Huri. I live in San Diego, California, and I moved to the United States in 2016, so it'll be 8 years. My pronouns are she, hers, and by background, I'm a global life science marketing director, so I deal a lot with cutting edge innovations, technologies, projects, campaigns that bring cutting edge research and really take it to the clinical side, so it can actually benefit clinicians and patients and their caregivers. But also my other life. So I've been with the Human Rights Campaign as a volunteer, and now I'm on their National Board of Governors for the last 8 years. And for me, my big focus is the intersection of my various identities. And when I said I had moved to the US, I grew up in Doha, Qatar. So that's where I'm from. And both my parents were Indian. So I have this Indo-Arab mix identity where I grew up in this diverse community, and that's the only world that I know. And everybody that I interact with has a multifaceted identity. For me, that is just the norm. So at the HRC, my focus now, I'm part of the BIPOC leadership program, the AANHPI program, and also my role is to ensure that when I look around at the table, who is missing and what we can do to close the gap, but also my perspective as a person of color, as someone who has grown up in the Middle East, and I think in different languages, I feel in different histories. It's about educating on the inside, especially as Hazem mentioned, as we're at this big inflection point as to what stories are being told, what are not being told, and also how that further exacerbates the issues and the unmet needs of the LGBTQ two-spirit youth and Black and brown trans communities. So I'm really excited to be here. And my favorite food, this is hard because I like rice a lot. So it's either biryani or majboos. Like you pick on any day, I will not say no. So anything with like meat and rice, I will be there.
Lovely. And once again, everyone, my name is John Sovek. My pronouns are he, him, and I am a therapist here in Pasadena, California. And I specialize in working with LGBTQIA plus youth and their families during the coming out process. I am also the author of the award-winning, yes, I get to say that now, Out, a Parent's Guide to Supporting Your LGBTQIA plus Kids Through Coming Out and Beyond. It's a really beautiful process, and it was an exciting project to me to birth into the world. And if I think back to a childhood comfort food, I was all into those like gingery molasses spices. So either gingerbread or ginger molasses cookies would be that thing that would just like the warmth of those spices would just like make me feel so like happy. So that would be my comfort food. So I want to just start us off with kind of a real basic and very innocent question. Looking at this acronym MENA, what does it stand for? What does it mean? What does it include? And how does the community itself relate to that acronym? I think that would help us all kind of get off to a good start by finding a common language here. So, Horia, you look like you have some thoughts on this right off the top of your head.
I mean, yes, there's so there's many different ways of saying it. The acronym is important to me, and I think you can't just talk about that acronym without talking about the other acronyms that surround it, right? And it is ever evolving because it is really just a reflection of the intersection of many countries and regions. And the further west you get from MENA, the less and less clear it gets. So MENA is basically Middle East, North Africa, right? Middle East. And then there was an evolution where it became MENA, Middle East, Turkey, and North Africa as well. And all of this is also within Asia. So it is part of Asia and APAC. So for me, it is important to spell it out, but also it is that acronym has so many countries baked into it that it doesn't do justice to the many lived experiences, and the humans are not monoliths. Like sometimes your parents can be mixed race, they can come from other countries, they have immigrated. So while it's an easy way of kind of bundling in many countries in a small acronym, it is in fact a huge diaspora of people of color and honestly mixed identities, mixed cuisines, mixed histories. So for me, I can maybe go between MENA and MENA, but also recognizing the Asian aspect of it and what that looks like. And yeah, I think I'll stop there and see what the others have to say.
Mhm.
I think MENA, as Horia mentioned, it's like the Middle East, North African, obviously. There was a push recently, and some people still use the acronym SWANA, which is West Asia and North Africa, just because what is the Middle East? Like it's Middle East of what? So just like this history context around Western colonizers and all of that history that the Middle East, North Africa went through. So a lot of people use SWANA now just in order to put things into more accurate historical perspective. Us at Tarab, we still use MENA because it's more recognizable and it's honestly, it's a more approachable Google search term for a lot of people who want to find us and find our services and be part of our organization, part of our community. But both for myself, this was the first time that I heard the term Horia mentioned. But also, obviously, it's more encompassing. And also, we need to emphasize that usually people, when they think about Middle Eastern North African, they think about Arab people only. And we need to emphasize the minorities that live among the Middle Eastern North African region, especially around southern Turkey, northern Syria, northern Iraq, and all of these areas. There were a lot of native cultures that started there. And now a lot of people that belong to these cultures in these historical contexts still live there and still identify as such, and they have their own languages, they have their own traditions, and they are very much protective of it, as they should be. So I guess that's my take on that.
Mhm.
Yeah, to add to what Hui and Hazem said, I think the answer, unfortunately, cannot be very simple to what MENA means. It is there's a long history around that term and the associated communities and populations that are referred to within that term. So yeah, similar to what Hazem said, there's a lot of colonial, Eurocentric, and Orientalist understanding of the Middle East term. And it is very much conflated with Arabs, with Muslim, even though when you think of the Middle East and North Africa, there's a lot of non-Arabic speaking countries. So when we think of Arab countries, these are like based on language, whereas the MENA is mostly based on this colonial interpretation of the Middle East. SWANA is the newer term that many activists now are pushing to be used because it moves away from that colonial understanding of the region. And it is more inclusive in terms of like regions, populations, races, ethnicities, religions within that category. However, like even within our own community, we have a struggle identifying with these terms because they're all interrelated, but there's also very unique understanding for each one of them. So it's just like important to like really understand like the uniqueness of each of these terms, but their interrelation as well.
Mm-hmm. And one of the things that I think is really important too, because of our topic today, so what happens when we mix in LGBTQI plus identity into this like large population and storyline? Like, what would you want to share with our listeners, our providers, about where the mix works well, where it doesn't work well, and how LGBTQIA plus identities play out in this larger story? Hazem?
Sure. Yeah. I mean, the first thought that crossed my mind was it adds much more complexity to the whole situation. As Sarah mentioned, there's a lot of different identities that people live in that area identify with and correlate with in terms of religion, in terms of cultural backgrounds, in terms of languages, in terms of all these smaller communities. And within the LGBTQ community, it's easier for people to identify with the country rather than the region. So like it's easier for them to say, I'm Syrian, I'm Palestinian, I'm Lebanese, gay, lesbian, queer, whatever. So obviously that identity as being Middle Eastern North African is complex by itself, given the cultural and religious aspects of it, being Muslim or Christian or Jewish or whatever it is in that region, and add to it the cultural norms of that countries, and add to it on top of it being gay, which is most of the time is illegal, most of the time it's unaccepted by the community. So being able to be proud of who you are in terms of your culture and community and background and country, and who you are as a person, of being queer, it's such a complex mission, and it requires a lot of maneuvering, a lot of support, a lot of I don't know, reconciling these two identities is something that we talk about all the time in the community support group that I facilitate. And it's a very, very common theme. And it's always an issue for some people, obviously, for the majority of the attendees, honestly, to the support group. And it's always a struggle, and it's and across multiple age groups. Like I had as young as 20 and as old as 45. Not that is 45 is old, but that's the age range that I got in the support group.
Watch it.
And two extremes of that and whatever is in between, they always have the same struggle. Obviously, add to it their family relationships, how to navigate that. So, yeah, it's that the complexity is the theme of these two identities.
Mm-hmm.
For me, the first thing like that comes to mind is like this multiple layers of invisibility of the community, especially here in the United States. When we think of the Arab, MENA, SWANA, whatever terms we want to use to reflect or to identify this community with, there's already a big layer of invisibility that we see. Add to it a sexual identity that is already invisible within the larger community, but also within the Arab, SWANA, MENA communities. Or so any person who identifies with the LGBT community will have this added invisibility. So you're getting invisibility based on your racial ethnic identity as well as your sexual and gender identity. So it adds to this complexity, obviously, and to those multiple intersectional experiences that creates so many layers of health disparities, discrimination, and I know we'll talk a little bit more about those. So this is something that would come to my mind at the beginning.
Yes, I can add a little to that, but I think the two of you have covered almost every, conundrum that happens. There is so much invisibility every time, just as myself, and I'm an ally, right? I'm an ally in this space. Every time I introduce myself, I'm not just introducing, I have to educate. There's always, I'm this, this, and this. And then I have to pause for some question that comes my way and then say, no, people like me exist. This is, just a idea of like, oh, why don't you wear a hijab, for instance, because there's a connotation. I'm like, oh, people like this exist. So there's always the level of education that is kind of the unpacking of it is on us at this time to educate and almost like do some myth busting. And you're right, because it's because of the lack of awareness, education, invisibility that now it is up to us to unpack and show not only within the MENA acronym, this is who I am and this is what this means, and then adding the gender identity and what that means. And then on top of that, what the layering of that means. And oftentimes, and I know we're going to talk a little bit more about this, I don't want to reveal too much. It's important in my mind, at least for as long as I live, to do the education part, because for the next person that is in my seat or is going to have to go and do that, if they don't have the parental support or the community support or even the information access in their geopolitical environment, then they're at high risk, either with themselves or in the communities that they enter. And it is okay, even though I work with the HRC, I see a lot of, Caucasian American or second, third, fourth generation folks who have already had a nice onboarding to this world. Even they go through safety and identity issues and the intersectional parts of it. So that's not to say that that doesn't exist, but it's even more complex for our communities, and the work remains to be done.
And I'd be curious too, just bringing up generational stories. What do you think the influence is for people of different generational experiences who have come to be in the US about their relationship to their identity, their community, their culture, their religion, and their willingness to express their LGBTQ identity? Any thoughts on that?
Yeah, I think from like some of the research that I've done with the community and talking about my own experiences as well. For example, for first generation immigrants, so born in an Arab country, have moved to the US, there's a big reality that people are faced with when they come here, where they find it hard to coexist in the US as both Arab and queer. And so a lot of responses from the community, like Maria was saying, is this surprise at your existence, even as a person who can be both queer and Arab or MENA, queer and Muslim and Arab. So like thinking of these two identities as very contradictory to each other. And this has been a big reaction from the mainstream community here in the US, where thinking of like experiences of folks back in their home countries, it's mostly just reconciling with their sexual identity, their gender identity. But coming to the US again, this added intersectional aspect of who they are as Arab, as Muslim, as MENA folks adds to that constant challenge about who we are and how can we coexist in the space. I feel like, I don't know, maybe others have others to say about like more generations down the line, like second, third generations. Obviously there is similar experiences, but I'm sure that there are other unique experiences as well.
I would say, given the the exposure that more recent generations are getting to more the ideas of what is a gender identity, what is sexual orientation, what is being queer mean, all of that stuff has the recent exposure given the internet access, TikTok, all of that stuff has made it somewhat easier for people to be more educated about what they're feeling. Myself, like I'm a first generation too. Have I grown up with these concepts? I feel like myself, I would have had a more streamlined or an easier uh, an easier acceptance process to who I am. I think that's one aspect of the generational stuff, but also what Sarah mentioned about like the the way people look at you when you declare that you're a Muslim and queer, let's say, because this stereotypical idea in people's minds, and even in the Middle Eastern community, not just plain white Americans or just the American culture in general, even within the Middle Eastern community, North African community, it is contradictory to be both, because it's illegal, because it's forbidden, because it's whatever it is. So being able to introduce yourself or educate people around that I'm queer and I'm Muslim, and I made peace with both of my identities, and they coexist, and I exist now. This is also a real struggle, and obviously it is based in some of the cultural norms that we grew up with, or that we had to fight against in order to exist. So I feel like all of these factors come into play when people are starting to discover who they really are.
Yeah, that's all of that and then some. I'll speak from my own experience and let you kind of use that as a springboard. I identify as Muslim, born into Muslim family. My parents were first generation immigrants in Qatar, in the Middle East, for the first time. And then I became a first generation American just 1 year ago. I got my citizenship. And in this entire journey, you have to look at my family and the family just lived across the street. Very different microcultures inside the household. On the other side of the street, very, I would say slightly more aware, college educated parents. Mine didn't go to college, so they had a very different perspective on life and acceptance and tolerance, and they had the vocabulary to communicate sexual identity. And in my house, just across the street, we were more conservative. Like I didn't probably date until I was in my late 20s. Like I didn't know what that was because it was, not accepted. Most of my families on both sides, my parents' mother and mother and father, they had arranged marriages, and the idea of even, with the opposite gender, which is heteronormative way of cohabiting, was also, something that went through a whole passage of approvals and consent from elders. So I'm far behind in even knowing what it is like to pick a partner for myself, let alone have the construct, like the identity of like where I stand on the spectrum of gender. So you really have to understand that it really comes down to an intersectional set of circumstances, and then the political and geographical construct. If you're living in the Middle East, then yes, there's a lot of other things. But all of that to say, I think I lead with, whenever someone comes back to me and says, well, I didn't know you could do that, or I didn't know queer Muslims exist. I think at this time, and it's a little, indicative of the work we have to do. It's 2024, and all I find myself repeating is queer Muslims exist. And then we can talk about the Asian or the African or the Jordanian, the Lebanese, the Egyptian. We can talk about that after that. But I think at this time, it's like we're fighting for just the acceptance that we exist. And I think a lot of that now, as Hazem mentioned, with social media, with art and storytelling, there is more vocabulary, there is more storytelling, there is more role models in the media. So now, as someone myself, if I saw this a long time ago, it would have been an easier journey. But countering that, now I know what different angles and triggers to tackle when someone asks me a question, so I can protect the next generation or the generation that is here about the various angles and the triggers we will be faced with as we go on and create the vocabulary, the language, and the story, the narrative. It's coming retroactively, not proactively.
Well, and taking a little dive off of that, we are looking at, and there's a question that came up in the Q&A, and I want to put it right out there. I think it's important that we are seeing a lot of violence focused on the SWANA MENA communities, and especially for LGBTQ people, where we have a history of violence towards our community. How do you think providers can best be aware of that and support it with the community members who may be coming to see them?
First of all, acknowledging that there is a genocide happening in Gaza is a first step, I think, to also recognize and support the Palestinian community, and specifically the Palestinian LGBT community here in the US. Second, like Huri was saying, like educating, talking more about what's happening in Palestine, identifying, especially within the healthcare system among healthcare providers. And I know a lot of your audience is part of that community, is also acknowledging the generational trauma that Palestinian and SWANA queer individuals have been facing, and the impact of these intergenerational traumas and the current genocide is affecting the mental health, the social isolation of individuals. Already, queer SWANA folks in the US feel isolated in terms of their visibility, in terms of finding community, in terms of fighting support. So adding to now what's happening in terms of being discriminated against for speaking up for Palestinians, this definitely has a big factor on the mental health, social health, and physical health of the SWANA queer community. So definitely a big impact for sure.
Yeah. As a Palestinian Syrian, born and raised in Syria, as a gay person, obviously it's heartbreaking. Genocide or not, it's people are getting killed left and right. So I don't call it what you want, but it is what it is. People are getting exterminated, and a whole population is, and a whole territory is being decimated. Palestine obviously has become a major issue for our community. I saw it a lot during the support groups. I started facilitating in November, so a month into the war. Up until last month, it was a constant topic of discussion in every single support group every month, because as Sarah mentioned, the generational trauma that people carry with them from the Palestinian cause, add to it being gay, any threats of violence that they might have gotten back into their home, back home, or even abroad, even in the US, it's not exactly the beacon of gay liberation that we think it is. People get harassed and bullied all the time in all different places in the US and all over the world. It's just as Horia mentioned before, we still have a very, very long way to go in order to remove this violence threat against the gay community. So seeing what's going on, tying what's going on into liberation, and thinking about liberation for everyone is liberation for the gay community, is what's the running theme that I've encountered throughout this whole 10 months period of interacting with members of the gay community in New York, gay Arab community, gay Middle Eastern, North African community. Even I got people from Iran, from Turkey into the support group. So this idea of liberation for all is the theme that is tying the gay community into the Palestinian cause. I completely and fully acknowledge that being gay is not accepted or legal in most, if not all, the Middle Eastern, North African countries. This is beside the point. This is not the point that we were talking about. Let's stop the killing. Let's free the people from the genocide that is going on. And then we can talk about gay rights and civil liberties, just as with any other war that is going on. We centered Palestine in all of our Pride events, Brooklyn, Queens, and New York. We got more than 98% of people attending these prides cheering us on and chiming in when we pass in the floats or the cars that we rented, blasting speakers with Free Palestine chants and Palestinian songs. People are empathetic. The gay community is empathetic with the struggles of these people as well. And there's a huge population of gay people in the Middle East and North Africa that are also striving for their liberation from their own governments and from their own tyrants. Add to it the killing. So sorry about the rant. So sorry about the rant. Please step in.
Keep breathing. Keep breathing. I'm going to step in for a moment too, though, because I think it's important for healthcare providers to understand that all these barriers to seeking care and the pressures on the community, which are trauma-based conversations right now. What do you think that healthcare providers need to bring into their awareness to better serve the LGBTQ SWANA MENA communities?
I was going to ask the question too, John, because I I had so many thoughts on that. Now, I will say, I was just in Doha, so I went back home for a wedding and I came back. So, as someone who has lived in two different parts of the world and very recently experiencing everything from this lens, but also that lens, and in my own journey, right, in my own journey of self-identification and my own journey for my own rights, and my own, I guess, dignity, right? At the end of it, it's my own dignity and who I want to be as a person. And mind you, the HRC side, we're tracking over 800 anti-LGBTQ bills in America, of all places, right? So we have to acknowledge that. For me, it's really about if I walk into a healthcare professional's office or a therapist's office, right? I want at least, first thing we do is we Google and see where can I find the BIPOC folks? Where can I find the Black folks? Where can I find the brown folks? Where can I find the folks that are Arab identifying? Because I don't want to even start with the A, B, C, and D somewhere in X, Y, and Z in my issues, right? Let's start there in the identities when we look up. That doesn't mean all skin folk are kinfolk. Like I have gone to therapists, I've gone to, HCPs who may identify with my South Asian identity, but they're still missing the mark because they have probably acquired a level of privilege. They went to medical school, they had parents who spoke English, there's all of that. So it is such a layered and difficult thing to master. However, what I think is a good common thread for anybody in a level of care or in a capacity of authority to offer gender affirming care, for instance, they need to take stock of what they don't know or of opposing views, and understand that they have a lot of power. They have a lot of power. They took a pledge. They have a lot of power. That does not change irrespective of your views or beliefs or your lived experiences. What they have to do is, in this pledge that I have made as a medical professional, how can I make this person feel safe? And to mind you, I use the rideshare apps. I use public transportation logistics. I have lots of conversations with people who are inquisitive about my identity as I pass in physical sense. There are times where I feel very unsafe. Like, where's this conversation going? There are times where I disagree with someone who looks like me and sounds like me and has the same last name like me, right? I disagree with it. But I do understand one thing, is our lived experiences are different. Their pain is very real, and I acknowledge that. But our lived experiences are different. So in this moment, while I may not agree with you, I feel your pain because I know what it feels like to not be understood and to not be received by my own or by others, and to constantly have to unpack where I'm coming from. We all have to understand that if we want to be on this earth and be good people, it is accepting that you will not fully understand the human experience because you're one vessel. You have to walk in other people's shoes and live in different places to understand maybe 2 or 3 identities. Maybe you read a lot of books and then you have different identities, right? You have to understand that. And I think your responsibility is to look to your left and right, front and back, and see how you can be a safe space for other people. That doesn't necessarily mean you're giving up your values or, you're making it about yourself. Decenter yourself and see what you can do in that space. And that is a paramount need for anyone that has the power and privilege to care for someone else. And that it is a powerful thing to be a doctor, to be a therapist, to be a counselor. It is a powerful thing. You have immense power.
And Sarah, I want to make some room for your voice as well, too. Thoughts about how providers, therapists, doctors, all levels of healthcare providers can be aware and present to create safe spaces for the LGBTQ MENA SWANA communities.
Yeah, I think like from a more, I guess, practical perspective, like working at a college of nursing, teaching nurses, future nurses, but also interacting with like medical folks and multiple healthcare professions, we definitely lack a lot of education and training around those intersecting multiple identities and what those mean. So I feel like to start, we need to work within our educational systems to really integrate better understanding of community needs, and to also be working with the communities and not just aside from the communities to getting at their needs. So a lot of the work, unfortunately, is not being done with the communities. So whether having representatives from the communities, like centering their voices and the way we teach and the way that we practice, but also providing trainings for current healthcare providers about their own biases, their own assumptions, their own understanding of certain communities and their own stereotypes around certain communities. So again, I know from the queer MENA SWANA community that I interact with, a lot of them, like Huri said, they look initially for people who look like them. And a lot of the research participants that I've worked with always say that we want people and healthcare providers who look like us. But that does not mean that we need to like also not ensure that across all healthcare fields, regardless of their identities, care should not be given in a way that supports and provides the best for the needs of the community. So training, education, advocacy, working with the community, I think these are all ways that we can help our healthcare system.
I just want to say that this is the major point of this panel, I guess, the access to care, basically. And this is what we hear from our community members all the time, especially around behavioral and mental health, is the lack of access to people or therapists, or very few people, very few therapists or psychiatrists or people who can provide this mental health support for you that have or understand your background. Even if they look like you, they might not have the same background, basically, or understand the culture around that. So it's always an issue. There's always a and I guess it's pretty consistent with the lack of access to mental health in general in the US, that the lack of access also to a somewhat of a specialized care for people like us. So I feel like if I'm a brown person or a person or from Middle East, North Africa, and coming to you as a therapist saying this and that, either you say, like, I'm sorry, I can't help you. I don't have the qualifications. I don't understand. I can refer you. I can look for different resources, or you educate yourself around the issue if you really want to help the person. I feel like also within our own communities, mental health and behavioral health also has a huge stigma still. People refer to it as insane people medicine. People who seek out behavioral health and mental health get ridiculed all the time. So also we need to address that issue in order to prevent people from being bullied for seeking therapy, and to encourage the new generation to actually seek career opportunities in mental health. Because if you're growing up with a family that always ridicule mental health, that will disparage you or they discourage you from seeking that career opportunity. So addressing these issues within our communities first also will provide a more stable pipeline of people who can provide these services to their own communities and benefit their own communities. So addressing the needs within our communities first seems like a good place to start, I guess.
And one thing that I've witnessed in these ongoing conversations we've had with different communities is in some cases, people may be searching for their LGBTQ identity to be recognized and reflected in the room. At other times, they may be looking for their cultural or religious community to be reflected in their room. We may not be able to find that perfect match where all of those come together. but understanding that these conversations like today are a journey to try and make those spaces more available to everyone. So if we look specifically right into the nuts and bolts of how healthcare providers could provide better resources to the communities we're chatting about today, what would you say are some real like nuts and bolts things that people could bring into their practices, their organizations, their health centers that could start making a difference after we finish today?
I can start because I know I had a bit of a waiting time. I think we're looking at nuts and bolts right now, John. We're looking at the ABCs, right? We talked about the work that we have to do for our community to organize and own our narrative, and also create vocabulary. And I think language is so powerful that sometimes I struggle in translating what I know so well in English into Urdu or Arabic, or to someone who, who speaks Farsi. It's so hard that we don't even have the language to begin with. So how can we go out and talk to our parents, our neighbors, our friends, our teachers, So it's like nuts and bolts. So one thing that I do day to day in my advocacy land is really building like either small assets like coming out guide, like the ABC. Like if you are coming out, then this is the guide. We are looking at even building tools that can, like an AI-based tool that can give you FAQs, frequently asked questions, but answers in those languages. So we build the proof of concept in English, and then we translate into Vietnamese, in Hindi, in Arabic, in French, in different types of languages, because all of that to say, there's different dialects too. The Arab culture, the diaspora, there's so many dialects. So it's about making sure that language is available so that you can at least start owning your narrative at a foundational level. And then I look to artists who write books for kids, right? Who create poems for kids, or story time, movies, animation. There's so much happening in the creator space on social media. I mean, TikTok is an example. I look to them so that we can give them the resources so they can create digestible content that can be used at a school level, that can be used at a community level. There's pop culture references that we can bring from like shows like Rami, for instance. I love Rami, right? There's a lot of the borrowed experiences from Arab and Indian shows that I watch. I even watch African and French shows that we can contextualize that in for our communities, for our parents. So I think about the power of language and how we can start bringing that into our communities. So those who don't necessarily like speaking English is a privileged skill. I want people to know that it's a big privilege to speak English well. So right now we have a huge delta in how we can and close that gap and start creating the content, the language, and then normalizing it so that it has access for all.
Mm-hmm.
I would add by do some basic homework research and look into your own region, city, space, wherever you are located, to look at what resources exist, what networks exist for the community. So simple examples like what we have here in Chicago is a small network of a Swana queer community. We go by the name Salon Kawakib. We're not necessarily like a healthcare provider community, but a lot of us are within this profession. We know people, we can connect people to people. It's going to be a lot of work, and this is and then there's, of course, Hazem can talk more about Tarab in New York and what they provide. But it is gonna be like challenging, but if someone is committed to providing like affirming and supporting care, a lot of work needs to be done up front. Again, we talked about the multiple layers of invisibility. We struggle with it to find resources, to find a community. Healthcare providers are also gonna be challenged with the same way to find what exists for the community by the community. So just simply put, do some work and look what exists in your own community to build those networks and those resource lists, whether it's a guide in multiple languages or it's a list of affirming healthcare providers that work with intersectional populations. So there needs to be some work to be done up front.
Sarah, I got really excited when you mentioned that you guys have this network in Chicago, and I would love to connect. We are right now for our second quarter initiatives, we're working on a resource list, a resource directory of sort that we can provide to our community members, especially people who frequent our community support groups. A directory list of therapists, social workers who might have this kind of background and this kind of expertise. Also, any artists, as Horia talked about, any people who can help you better tell your story that we can connect you with. So I would love if you drop the name of your organization again, and I would love to collaborate more. But I want to say that also, this is like what can you do if you don't have the resources of language, if you don't have the resources of finding a therapist that is very specialized in that area and that culture and that background. Just basic human decency. If you can't remove your biases from providing treatment or providing therapy for that person, just simply apologize and refer them to someone else, or educate yourself around the issue. And what happened, I want to apologize for what happened in the chat too, because this is exactly the opposite of what we were talking about. This is excluding access. We're here as Middle Eastern North African people talking about the issues that matter to us as a gay MENA community, and people are denying us access to talk about that by throwing their own biases. So I just wanted to say, like, if you have like an overwhelming feeling of biases against these people, just remove yourself from the situation and provide basic human decency. But I do agree with Sarah and Horia as well about all the different resources that should be available at our healthcare providers, especially mental health care providers.
And we're coming to the end of time now. There's a question we like to ask at the end of every Out Talk, and it really has to do, taking into consideration your work, the conversation we've had today, the world you're working in right now, is what is your hope or vision for the future of the healthcare access to LGBTQIA, SWANA, MENA communities? Your hope or vision for the future?
I can go. My hope and vision for the future. Oof, that's a lofty one, John. I will say, I think we are, even for the LGBTQIA community, right? Just take out the identities. We're still discovering the language. For the LGBTQIA community, we're still discovering the lived experiences. I am seeing friends who are on sort of the spectrum of change and transition, right? And they have all the resources and language at their doorstep. We're still discovering that. So for us, I think it's about centering the leaders who are often under-resourced. So at least in the work at least I do at HRC is I have a fund that I pull through funds from, so I can go and give money to that mom down the street who is Asian and is trying to raise a trans daughter. I want to go and put the money there. Let's give them the funds. Show up to their events and ask them, what can I do for you? And don't be surprised if they say, you look nothing like me. You sometimes also represent the oppressor, and that's a big one with BIPOC communities, is put your money where your mouth is, show up, do the things you can in the community to close the gap, and then take it on yourself to educate your peers, because they will listen to you first. So when that happens at a compounded effect, what happens is there's more awareness. For my experience is my experience, and someone else's experience is this layered. How can I receive them with that level of sensitivity and respect? And also, I'm okay with saying, I don't know what this means. I don't know what your pronouns mean. I'm sorry if I dead named you, right? Like, we're doing that now. So there's some getting in the habit of good habits for others is important, but also take it upon yourself to know how to have those good habits. And then I think the compounded effect of that is going to be a community that is okay with some discomfort, but leans into it.
I would just say a few words. Like, if I want to think of a vision, a dream, is that like the ability to every MENA LGBTQ person to be able to access healthcare without fearing or worrying about facing any form of violence or discrimination or bias. This is a simply put vision, I guess. I know we're short on time, so thank you.
Similar to what Sarah said, I would love for the future vision of this not being a thing. Like, we don't have to have a panel about it. It should be something naturally accessed and easily accessed. So I would love for that to be the future, and for our conversations not to be hijacked as gay Middle Eastern North African people. And thank you so much for having us again.
Absolutely. It's been an honor to share this space with you all today and to learn from your lived experience and to carry cultural humility into this experience and conversation today. So once again, I want to thank all of you for being with us and those of you who are listening today. Next month, we're coming back and we're looking at modern queer relationships, breaking stigmas and embracing diversity. You know, relationships come in lots of different forms and labels and different ways of expressing themselves. And whether you identify as monogamous or consensually non-monogamous, you engage in open relations, polyamorous, asexual, aromantic, all these identities really deserve respect and an understanding, especially for those of us who are healthcare providers. So we're going to be looking at insights and strategies for supporting diverse relationship structures. And this is going to be taking place on August 15th, 6 o'clock Eastern time, 3 o'clock Western time. And you can sign up, same place you did for today, OutCareHealth/OutTalk. And today's recording should be available towards the beginning of next week, so you can share it with your colleagues and get the word out into the community. Once again, thank you all so much for sharing with your wisdom, and everyone have a blessed rest of your day.
Thanks, everyone.